Demonstrate another method of making a snare in Catalab with a guide extension. So precisely why snare with guide extension is slightly better than snare with guide is. So when you have a guide extension, this guide extension acts as mouth for the snare, and your guide can guide to rotate your snare in 360 degrees. So you'll have a little bit of direction control on the snare when you have guide extension inside. So that's only advantage. And also you can have an extra length to get in so into the vessels, like if you have to do in carotids or subclavians, and then you have an extra length to play with. So that's an advantage. So now I'll demonstrate how we do that. So same thing as before. So first send your PTCA wire. I think okay. So send your PTCA wire into the guide. Yeah, so now the other end of the wire you can see here, so it is out of guide, and then now I'm just sending guide extension over it. Okay, and I will also take a balloon on this. Give me balloon 2.5. Yes. Okay, you can take even 2.25 is also fine for guide extension. This is 6 French guide extension. So it's essentially it should match with the ID of the catheter. So that's the idea. So yeah, I'm just sending balloon into the guide extension. Yeah, so now I introduce both. I'm advancing both. Yeah. Yeah, so you can see now. All right, just a minute. It's already out, so I'll just send guide extension. Yeah, so now your guide extension is out. So now what I'm doing, so I'll take wire slightly back, right, and then I'll introduce the tip of the wire into the guide extension. Okay, slightly deeper. Then I'll bring balloon back. Okay, yeah, so now we inflate balloon, inflate. Okay, 16. Yeah, so we inflated balloon. So now this acts as a snare. So you can see so reducing the size of the snare, increasing the size of the snare. So this stuff can be done. And another advantage is, since you have a guide here, by rotating guide, you can increase the orbit of your snare. So you can basically scavenge things in a bit larger radius. So that's an advantage with this kind of setup. So just to give a rough example, let's say this is what I'm snaring, and pull it back. Okay, and then you can bring that to the mouth of the guide. Okay, and and the grip also will be, you know, quite good, unlike your simple guide assisted, you know, snaring. So you'll have a good grip here, and yeah, you can just take it in. So this essentially, you know, basically increases your orbit of, you know, scavenging in bigger vessels, and also gives an extra length to go into, you know, carotid subclavines, and, you know, even brachials, you know, to scavenge. Thank you.